Acupressure for carpal tunnel syndrome. Carpal tunnel syndrome is a common condition caused by pressure on the median nerve, which runs through the carpal tunnel in your wrist. This pressure can lead to pain, numbness, and tingling in your fingers, particularly the thumb, index, middle, and part of the ring finger. Acupressure is a safe way. 1. What is carpal tunnel syndrome? Carpal tunnel syndrome occurs when the median nerve, passing through the carpal tunnel in your wrist, becomes compressed by surrounding tissues. This compression leads to the characteristic symptoms of pain, numbness, and tingling. Causes of carpal tunnel syndrome: repetitive hand movements, typing, using a computer mouse, playing musical instruments, etc. Incorrect posture, prolonged wrist bending, lack of wrist support, etc. Pregnancy due to hormonal changes and fluid retention. Thyroid disorders, hypothyroidism or hyperthyroidism. Causes of carpal tunnel syndrome: diabetes, high blood sugar levels can damage nerves. Rheumatoid arthritis causes inflammation and compression of the nerve. Obesity, increased body weight puts more pressure on the nerve. Symptoms of carpal tunnel syndrome: pain, numbness, or tingling in your fingers, especially the thumb, index, middle, and part of the ring finger. Pain that may travel to the wrist, arm, or shoulder. Weakness or numbness in your fingers. Difficulty gripping objects. Stiffness in your hand in the morning or after waking up. Symptoms of carpal tunnel syndrome: a burning sensation in your palm. 2. Acupressure for carpal tunnel syndrome. Acupressure is a drug-free treatment method based on the principle of applying pressure to specific points on the body to regulate energy flow, relieve pain, and promote healing. Acupressure points for carpal tunnel syndrome: outer guan li 15 located in the middle of your wrist, on the outer side of the wrist bone, just above the tendon of the thumb extensor muscle. Hiku li 4 located between the thumb and index finger, on the back of your hand. Acupressure points for carpal tunnel syndrome: Shen men ht 7 located in the wrist crease, on the inner side, near the wrist bone. Nei guan pc 6 located in the middle of your wrist, on the inner side, near the wrist bone, 2 finger widths from the wrist crease. Acupressure points for carpal tunnel syndrome: Li K Ki 3 located on the inner side of your wrist, 2 finger widths from the wrist crease. Acupressure technique: preparation: wash your hands thoroughly. Apply pressure in a comfortable position. Application: using your thumb or index finger, press firmly on the A-cup ointment in a vertical direction. Hold the pressure for 510 seconds and then release. Repeat this process 1015 times. Acupressure technique: note, some discomfort is normal during acupressure, but if the pain becomes unbearable, stop. 3 benefits of acupressure for carpal tunnel syndrome: reduces pain, numbness, and tingling in the fingers. Improves grip strength and finger mobility. Promotes blood flow and energy circulation in the wrist and hand. Decreases inflammation and swelling in the wrist area. Safe and effective, with no known side effects. 4 considerations for acupressure for carpal tunnel syndrome: it's best to receive acupressure treatment from a qualified acupuncturist or practitioner with experience and knowledge of acupressure techniques. Follow the acupressure practitioner's instructions regarding the duration, frequency, and pressure applied. 4 considerations for acupressure for carpal tunnel syndrome: combine acupressure with other treatment methods, such as physical therapy or medication, as directed by a doctor. Maintain a healthy lifestyle, engage in light exercise, avoid repetitive movements, and ensure adequate sleep. 4 considerations for acupressure for carpal tunnel syndrome: monitor your health closely. If your symptoms worsen or fail to improve, consult a doctor promptly for proper evaluation and treatment. 4 considerations for acupressure for carpal tunnel syndrome: acupressure is an effective complementary treatment for carpal tunnel syndrome, but it cannot replace other treatment methods entirely. For the best results, consider combining acupressure with appropriate treatment options and seeking guidance from a qualified healthcare professional.